Your baby's crying won't stop, there is a mysterious rash, and you're wondering, should I call the doctor? If you're a new parent feeling overwhelmed, this video is going to save you so much stress. Stay with me. Hey everyone, welcome back to the channel. If you're new here, I'm so glad you found us. We're all about making parenting easier, healthier, and less stressful. Before we dive in, do me a quick favor. Hit that subscribe button and ring the notification bell so you never miss our weekly parenting tips. Trust me, you'll want these in your corner at 2 a.m. when you need answers fast. Today, we're covering the essential health tips every new parent needs to know. From taking care of that umbilical cord to handling diaper rash, colic, and knowing exactly when you need to call your pediatrician. Think of this as your quick reference guide for those common but confusing baby health situations. Let's jump right in. First up, the umbilical cord. I know it can look a little strange at first, but caring for it is actually really simple. So here's what you need to know. That little stump will naturally fall off within 2 to 3 weeks after birth. Your only job? Keep it clean and dry. Here's how to do it. Make sure you fold your baby's diaper down below the cord. You don't want the diaper rubbing against it or getting it wet with urine. Once or twice a day, take a cotton swab, dip it in a little rubbing alcohol, and gently dab around the base of the cord. This helps keep it clean and speeds up the drying process. Now, when to call the doctor? You'll want to call your pediatrician if you notice any redness or swelling around the cord, if it starts bleeding more than just a tiny spot, if there's any oozing or pus, or if it has a foul smell. These could be signs of infection, and you'll want to get that checked right away. But in most cases, it's totally fine. Just keep it dry, keep it clean, and let nature do its thing. Next, let's talk about circumcision care if you've chosen to have that procedure done. The healing process typically takes about 7 to 10 days. During that time, the tip of the penis might look a little red or irritated, especially from rubbing against the diaper. Here's what you do. Each time you change your baby's diaper, apply a small amount of petroleum jelly to the area. This creates a protective barrier and keeps things comfortable while it heals. You might also notice a yellowish coating forming over the area. Don't panic, that's not pus. It's actually part of the normal healing process. Just keep applying that petroleum jelly, change diapers frequently, and you should see complete healing within that week to 10-day window. If you notice excessive bleeding, strong-smelling discharge, or your baby seems to be in significant pain, definitely reach out to your healthcare provider. All right, now let's talk about every parent's nemesis, diaper rash. Prevention is key. The #1 way to prevent diaper rash is change those diapers often. I know it seems obvious, but moisture is the enemy here. The longer wet or soiled diapers sit against your baby's skin, the more likely a rash will develop. At every diaper change, wash your baby's bottom with warm water and a gentle soap. Pat dry thoroughly. Don't skip the step. Then you can apply a thin layer of zinc oxide paste or diaper rash cream as a protective barrier. If a rash does develop, don't worry, it happens to almost every baby at some point. Here's how to treat it. Give your baby some diaper-free time. I know, this sounds scary, but lay down several folded cloth diapers or waterproof pads and let that little bottom breathe for a few hours a day. Air exposure works wonders. Continue washing gently at each change, and now apply a thicker layer of zinc oxide or diaper rash cream. If the rash doesn't improve within 2 to 3 days, or if it looks severe with blisters or open sores, call your pediatrician. Some rashes can be caused by yeast or bacteria and might need prescription treatment. Let's quickly cover 3 more common situations: diarrhea, colic, and colds. Diarrhea. If your baby has diarrhea, this is one you want to watch closely, especially in young infants who can dehydrate very quickly. If you're breastfeeding, keep nursing. Breast milk is incredibly healing. Your doctor might also recommend special oral electrolyte solutions designed specifically for infants. Call your healthcare provider right away if your baby won't take liquids, can't keep anything down, has severe diarrhea, or if it lasts longer than 12 hours. With babies, we don't wait and see with diarrhea. Colic is that inconsolable crying that can last for hours, and it's absolutely exhausting for parents. First, rule out the obvious. Is the diaper wet? Is baby hungry? Is clothing too tight? Are they just lonely and need holding? If everything checks out, try holding your baby's stomach down across your knees and gently rocking them. The pressure on their tummy combined with motion can be soothing. Or try pushing them in a stroller. Sometimes movement and fresh air work magic. And colds, when your baby catches their first cold, your main job is comfort. Keep them hydrated, use a cool mist humidifier, and consider saline drops for a stuffy nose. Here's the important part. If your baby develops a fever, especially if they're under 3 months old, call your doctor right away. Young babies with fevers always need to be evaluated. Now, this is the section I want you to screenshot and keep on your phone. These are the signs that mean you need to call your pediatrician immediately. No waiting until morning. Call immediately if your baby has breathing problems or is working hard to breathe, is crying more than usual or in a different way or seems to be in pain, has a temperature higher than 100 degrees Fahrenheit, is vomiting, not just spitting up, but actual forceful vomiting, or has severe diarrhea more than 2 to 3 times in a day, has even one large, very watery bowel movement if they're under 3 months old, passes blood or blood clots in their urine or stool, has a convulsion or seizure. Also call if your baby seems weak or doesn't have energy to cry as loudly as usual, refuses to eat or nurses poorly, isn't waking up as alert as usual or seems unusually lethargic. Or honestly, if they just don't seem right and your parental instinct is telling you something's off, listen to that gut feeling. You know your baby better than anyone. Healthcare providers would much rather you call and have it be nothing than wait too long. Pro tip, when you call about a sick baby, write down the advice you're given. Keep a pharmacy phone number handy in case your doctor needs to call in a prescription. Being prepared reduces your stress in those anxious moments. And there you have it, your essential guide to baby healthcare. Remember, the first few months are a learning curve for everyone. You're not expected to know everything, and it's totally okay to ask for help. The key takeaways: keep things clean and dry, watch for warning signs, trust your instincts, and don't hesitate to call your pediatrician when you're concerned. That's literally what they're there for. If you found this helpful, please give this video a thumbs up and subscribe to the channel for more practical parenting advice every week. Drop a comment below telling me what baby care topic you'd like me to cover next. You've got this, parents. Take a deep breath. You're doing an amazing job. I'll see you in the next video.